Today we're talking about something many of you complain about, pains in your neck, arms, and hands. And the cause could just be a group of nerves. Here to explain that and how to get treated is Dr. Richard Busch from Busch Chiropractic. Dr. Busch, let's talk about this. Okay, so people have the pains here, sometimes here as well.
Right.
You're saying it's the back.
In a lot of cases it is. Now, you can have problems with your rotator cuff. I'm sure you probably have heard of a rotator cuff. And what that is that's a group of muscles in your shoulder joint itself. There are 4 muscles that make it up at the supraspinatus, infraspinatus, teres minor, and subscapularis muscles. Those actually help make up the rotator cuff.
Okay.
And damage to any of them can cause shoulder pain, okay? Very often, as far as that's concerned, when we see somebody like that, or when we see somebody who actually tears that, then we have to do some other things where we can actually work with it from a therapy standpoint, where we actually use some of the things I've talked about in the past with like extracorporeal shockwave therapy, which helps break up scar tissue and adhesions. And it actually helps cause the body to heal. But we also sometimes will use lasers, we'll use exercises, and along with that, we may even manipulate the joint itself, so where we actually adjust it.
You brought this visual aid in.
I did. Now, as far as this is concerned, the reason I brought this along is, along with that, very often the problem could actually be coming from your neck or the lower part of your cervical spine. We have a group of nerves that comes out of your cervical spine. It's called the brachial plexus, and it actually comes down to the muscles in your shoulder, arms, and hands. And if we have pressure on any of those nerves as a result of a degenerative disc, a herniated disc, something like that, or even what's called spinal stenosis, where that area where those nerves come out are actually getting smaller, that can actually cause, number one, pain into the lower part of your neck, your shoulder, your arm, even numbness or tingling all the way down into your hands. And so as far as that, exactly, and so along with that, you also mentioned at one point that you have carpal tunnel syndrome. And as far as that's concerned, that can also be coming from the lower part of the neck, or it can come from any of the areas where there may be some entrapment of the nerves between your shoulder and your hand. As far as treatment, so we just talked about what we do to treat the shoulder problem, and again, a lot of that's exercises, but also along with that, some other types of therapy that we'll use.
And what about the hands
and even manipulations? Well, that's something that, remember, when we talked about extracorporeal shockwave therapy, that'll help break up some of the scar tissue and adhesions. But if we have and/or lasers and that type of thing, but if we have pressure on the nerve in your neck, then we also need to use something like the DRS program, where we can actually pull that disc level apart. That helps take the pressure off the nerve, allows that disc to heal, and actually allows your body to begin the healing process. As we do that, you know, sometimes patients that have that type of problem will also notice headaches, but along with the numbness and tingling in their hands. And I think probably in the near future, we're going to want to revisit the carpal tunnels, because you missed that one.
Yes, I did. And there is so much to talk about. We can't go on right now. We can't get it all right now.
Exactly.
But we're going to be seeing you throughout the year, talking more and more about this. Doc, thanks for coming in.
Thank you so much.
You can learn more about the Busch Chiropractic Center by calling the number that you see on your screen or heading to buschchiropractic.com. And you can watch Medical Minute every Monday during our new newscast. Coming up, Greg has a final look at your 10-day forecast.